Hello, Faith. My name is Bev Burk, and I'm the Health Services Coordinator for Jenks Public Schools. And in addition, I've been working for the Oklahoma State Department of Education on a CDC grant to provide resources across Oklahoma for COVID-19 practices and procedures.
Hey, Faith family. Alan Martin here, just to talk about some questions that I've heard about COVID-19 and the vaccination process.
It's easy to get sidetracked with community myths and long-held fear-based opinions. And I encourage everyone to make personal decisions for health that are based on science.
One of the big questions is how effective are these vaccines? And the answer is the first two, Pfizer and Moderna, very, very effective. Amazing that they actually got these out in less than a year. And how effectiveness, what we mean by that is just, do they prevent the disease? And the answer is absolutely. The first two that have been approved, and 95% effectiveness on preventing disease activity, and that's mild to moderate activity. As far as severe things that we ended up in the hospital and even dying from, essentially perfect from the standpoint so far.
So vaccines promote our innate immune system to produce antibodies that neutralize this virus. They basically kill the virus, they destroy the virus, and this allows us to get rid or resolve the infection caused by the SARS-2 virus.
The second most common question I get is, are the vaccines safe? The mRNA technology has been highly invested in, researched, and applied to healthcare since the early 2000s. And it's already been a game changer in the fight against cancer and the fight against many other diseases. The mRNA technology simply tells our body what to get ready for and to identify an intruder and signal our immune system to fight it off before it can cause disease.
What's the risk and benefit analysis of actually getting the vaccine? And I think the risk of any vaccine is just getting the vaccine. What problem is that going to cause? At this point, the studies really don't point towards a lot of long-term things. Of course, we would love to have these medications studied for years. That's not something that we have time to do at this point. Yes, there can be some side effects of getting the vaccine. Just immediately, you might have a sore arm, maybe a headache, some nausea, fatigue, some myalgias, and which is achiness, and some fatigue issues, but that's very short-lived.
Those things are transient, and they represent that the immune system is waking up. It's doing its things.
And these reactions can be intense, but typically last less than 18 hours. And most importantly, do not cause the dangerous inflammatory response in the body that's associated with COVID-19 deaths.
So the risks of getting the vaccine, I think, are very, very low. The benefit, absolutely, it's a no-brainer from my standpoint as far as the benefit of getting the vaccine.
Yeah, but was it rushed to get it out on the market?
FDA standards determine safety, regardless of whether it took 9 years or 9 months to get a vaccine to the public. The same 3-phase safety protocol and corresponding timelines were in place for human testing of COVID vaccines. The 3 phases must be completed with a required number of participants, research time, and evaluations.
The testing that was done is adequate. There were no shortcuts that were taken to not test the safety of this particular vaccine.
The bottom line is the FDA is going to approve ones that are effective. And again, a very important time to get vaccinated when your turn is called up. I guess the other question is if you've had COVID-19, do you need to get a vaccination? The answer is, of course you do. The answer is that your natural immunity, in other words, the immunity that you received or that had the illness, may not last very long. So yes, we do recommend that we do get a vaccine in that case.
So if you've had COVID and gotten over it, you still need to take the vaccine. We know that the vaccine will give you more enduring immunity to the virus.
Another question that I've heard is, after you get vaccinated, do you just have to quit masking and quit washing your hands and go out and not worry about it? And the answer is absolutely not. The numbers recently, and again, this is early February at this point, the numbers are going down a little bit, but we don't know about the variants and the mutations over the next few weeks that are certainly going to have a higher prevalence in the United States. We don't know how that's going to affect us. And then we don't know if we can still get the disease or the infection after we've had a vaccination and still spread it. So the answer is really no difference at this point. Still need to mask up, still need to wash your hands, still need to keep social distancing, still need to stay away from activities that don't have very good ventilation and those type of things.
The longer it takes to get 70% of the world vaccinated, the more opportunity the virus has to mutate and become more deadly.
Hey, you're trying to help slow down this pandemic and trying to help other people. If we get vaccinated, the likelihood that we're going to actually get the disease is very low. So the likelihood that we're going to spread it is very low. Again, not 100% knowledge on if we get the vaccine, can we actually spread it? But we'll figure that out. But it's certainly going to be helpful.
I believe that this is a way that we can maintain integrity of our Christian community, of our congregation, of Tulsa, and really the bigger picture, the entire world.
I encourage you to read the science, to talk with your physician, and when you're able, to get a vaccine like Rick and I and my family members who are also public servants have done. Remember, you're not only vaccinating to protect yourself and your community, you're vaccinating to protect the world's population. Thank you.
So hopefully this kind of clears up maybe some of the questions that you've had. We're trying to certainly answer things as best as we can, but realize that this is an ever-changing aspect and really changes day by day, week by week. And certainly we're all going to get through it. So be safe, Faith Family. My pleasure.